Only a Medicare for All plan can provide health care for all of us that is effective, efficient, portable, equitable, and of quality.
Are doing all the work, paying all the taxes, and it's all going up to the people at the top. That's unfair, unequal, and it needs to stop.
You know, we say all the time that children are the future of our community and our world. Do we really mean that? When you think about the fact that there's 37 million children on Medicaid right now and millions more adults that are disabled, and we are putting them at risk. It's easy to look away when it's not you. It's kind of like a car wreck, and you see it and you say, whoa, I hope nobody's hurt, but you keep driving by. Right now, this is a car wreck, and there are a lot of people who are going to get hurt, and you know, eventually it might be you.
Welcome everybody to our Medicare for All rally in protest of the worst bill ever written in the United States of America. The new health care bill, which has nothing to do with health, to do profit, greed, and causing the very thing it's supposed to help.
And just plain meanness, Terry.
And just plain meanness. When you kick 23 million people off, we don't even have that good of a health care system to begin with. So we're advocating for Medicare for all, like every other major country in the world has for its citizens. Only one, us, United States of America, does not provide national health care. My brother lived in Australia for 10 years, went to a hospital for over 2 weeks. He had a card as big as a library card. That is all that was required. No paperwork, no bills he got. And not only did they pay all the hospital bills, they sent a doctor to check on him when he got out to make sure he was recovered. And that was covered.
Terry, I have a question. When they complain about taxes, how would that work here in the United States? They say that we can't survive because of taxes. How does that work?
You get the for-profit
They
insurance
pay,
companies.
Australia pays fairly high taxes. Look what they get for it.
Right.
I think we pay fairly high taxes, and I don't see too much that we get for it. But I want to get going because we have some wonderful speakers, and I don't want to take up all the time. So I just want to say that we are videotaping, so I hope nobody has a problem with that.
No.
And the format is, we have 5 speakers. We've asked each of them to speak 2 minutes. And then anybody here that wants to comment, please do. So that's basically it. In preparing for this rally, I found an article that Edith sent in the Washington Post, written by a woman in Bloomington, Indiana, who's a medical receptionist, and she said it all. Her son, now 12, was born with a defective heart problem. He's had multiple open heart surgeries and other procedures. He survived because of Medicaid. She said this is not, her name's Audie McCullough, this is not an issue of hard choices. This is an issue of life and death. So with that, our first speaker is Edith King. Edith is with Futures for Common Sense Health Plan, which is the sponsor of the rally today. She can tell you a little bit about that. Based in Bloomington. She's also a licensed clinical social worker and my great friend.
Hi. Welcome. I'm a licensed clinical social worker with over 35 years of experience in human services and social service with a specialty in mental health. I am also the co-coordinator of Hoosiers for Common Sense Health Plan in Northeastern Indiana. We The other co-coordinator is Dr. Jonathan Walker, Allen County retinal surgeon. He could not be here today because he's doing surgery. Hoosiers for Common Sense Health Plan is the Indiana affiliate of Physicians for a National Health Program. They began in 1987, and they are and continue to support a Medicare for All plan. Only a Medicare for All plan can provide health care for all of us that is effective, efficient, portable, equitable, and of quality. 76, first introduced into the House by John Conyers of Michigan in 2004. There are currently 112 sponsors. It has never had a hearing, even under President Obama. But a Medicare for All plan is not before us now. Before us today, we have a budget bill, a tax reform bill. It is called the Better Health Reconciliation Act of 2017. Along with the House bill, the American Health Care Act, these are both meant to decimate Obamacare, the goal of the Republican Party. I read in the newspaper, in the Journal-Gazette, that Senator Todd Young isn't sure how he's going to vote on the Better Care Act, but he says nothing can be worse than Obamacare. Really? I have no idea who he's been talking to, but clearly not the approximately 500,000 Hoosiers who were able to access health care, and some still do, on the exchanges and on the Medicaid expansion in Indiana, HIP 2.0. Yes, the exchanges have become more expensive. Healthcare in general is more expensive. We have no cost controls with private health insurers. The Republicans have chipped away at the taxes that support Obamacare. However, all the major insurance companies have continued to make a profit, but just not enough for them. The entire country cheered when we had the end of pre-existing conditions, gender rating, and lifetime maximums. Both the Senate and House versions of the trashing of Obamacare put this all back into the mix. Plus, they cut federal subsidies to Medicaid dramatically. Expelling and arresting the disabled from the Senate building last week is the metaphor for how the Republicans currently feel about the sick. Get them out of here, we don't want to see them, and we don't care. We don't care. Neither the House nor the Senate bill has anything to do with better health, but everything to do with more wealth. It is dastardly, draconian, and Dickensian in its intent. We urge you, Senator Young, to vote a resounding no. Thank you.
Yeah, that's great.
Somebody profits our blood money.
Yes.
Go ahead.
Now we have another member of Hoosiers for Common Sense Health Plan. And Zaro is also a retired registered nurse.
Okay. Well, I'm not as well organized as Edith here, but I would be one of the first people to say that there are certain problems with Obamacare that need to be definitely rectified, most having to do not with the Obamacare law itself, but with how the insurance companies have used that law in order to maximize their profits and minimize how much health care people are still getting it. And there's work there that absolutely has to be done. But the Senate and the Republican Senate and the House bill as well are not even minimally interested in actual people's health care. They are not interested in rectifying what is needs to be corrected in Obamacare. The only thing they are interested in is one, exterminating anything that Barack Obama managed to get done, and making as much money as possible for the people who already have more money than they know what to do. So the two bills that have come out of the House, and one that the Senate just released after hiding in the dark closet for a couple of weeks while they concocted it. And as soon as it comes out, you knew why they were hiding in the closet. They do a number of really dreadful things. First of all, they take the money that, all of the money that was in some taxes that were passed to support the health care of people who need care. And they want to shovel all this right back to the very, very wealthy people that it came from. Nobody that's not making at least $250 million a year is going to get much benefit out of this tax relief. It's tax relief for people who don't really need a whole lot of relief. But it doesn't specifically say that the insurance companies can go back to discriminating for people because of pre-existing conditions, or put lifetime or annual caps on what they'll pay for. But it allows states to pass waivers, which will accomplish the same thing. So state by state, there will be a lot of different levels of medical care, but the people who were desperately endangered by being excluded from health care, if you could imagine the irony of a health care system that excludes people who are actually sick. Let that sink in. But they're going to, in a roundabout way, they're going to bring all of that back. One of the most appalling things they do in the House bill, and especially, particularly in the Senate bill, is absolutely decimate, obliterate Medicaid slowly, sort of sneakily through time. So at first you won't notice how much is missing, but you know, about 20% of the people in this country use Medicaid in one form or another. It's not just low-income people, but it is also essential, absolutely essential for the disabled, for disabled children, for children in general. A large proportion of our children are insured through the Medicaid program in one way or another. Almost half of all pregnancy and delivery care is covered under Medicaid, and if you don't take good care of mothers before the babies are born, and you have babies that are born prematurely or with difficulties that were not picked up or appropriately treated, then you have lifelong problems that we all get stuck supporting. So what kind of maternity care people get is very crucial. And just short of 2/3 of the people in nursing homes are supported under Medicaid, because Medicare only covers what, about 100 days, and after that you go through all of your own assets, and when you have exhausted your own assets, then the only thing that supports you in a nursing home is Medicaid. Now, I had an example in my own family just recently. I had a stepmother who lived to be 106. She lived alone in her own home, under her own steam, took care of herself till 103, when she fell out of a wheelchair and broke her hip, and that kind of was the end of that. The family took care of her as she went to live with relatives who cared for her for about a year, but then her needs were just overwhelming. They could not meet her needs appropriately at home. The sale of her home covered less than a year of care in a nursing home, and maybe the last year or a little more of her life she was under Medicaid. But if you have exhausted all of your own assets and you're still breathing. What are they going to do with you? You know, my question I posted the other day was, okay, are they going to put them out on the lawn in their wheelchairs with a sign that says free grandparents, take one home? So, sort of like
Yeah.
free kittens, but a little harder to place. There is nobody saying a blinking word about what they're going to do with all of these people who are totally dependent on Medicaid for not frills and fancy stuff, but for absolute minimum, basic, crucial care that they have to have. And okay, I'm done here. Tell Todd Young not only no, but hell no.
And that's what this bill, those are the people that suffer the most, as usual in America.
Can I just say John is the CEO of the Urban League, but before that, he was the director of Allen County DCS, so he knows a lot.
Yeah.
He's a good man. And I went to school with him.
So really, this whole issue was, what are you willing to accept? I mean, Terry talked to us in the beginning. He said this is a life or death scenario, and it is. I mean, when you think about insurance, insurance is something that in a westernized, liberated community, it should be there for all of us. You know, I did work as a director of the Division of Family and Children for 10 years. And during that time period, I had people who were in the last stage of cancer and they weren't eligible for Medicaid. They were taking Advil for their pain. You know, that's just cruel and unusual and should never happen in a country like this. You know, we say all the time that children are the future of our community and our world. But do we really mean that? When you think about the fact that there's 37 million children on Medicaid right now and millions more adults that are disabled, and we are putting them at risk. It's easy to look away when it's not you. It's kind of like a car wreck, and you see it and you say, whoa, I hope nobody's hurt, but you keep driving by. Right now, this is a car wreck, and there are a lot of people who are going to get hurt, and you know, eventually it might be you. And so we need to step up now, and we need to make health care available for everyone. We can't afford to look away. We can't afford to just say, it's not me, I don't have to worry about it, because the people that are going to create a better world in the future are our children. If we really believe they're our greatest resource, we can't accept this bill. Thank you.
Thank you, John. Now we have a member of the medical profession. Doctors take an oath to save lives, do no harm, unlike this bill. This is Dr. Al.
I'm a family medicine resident here in town, so I work in the clinics and the hospitals in the area. I'm also here as a representative of the Physicians for a National Health Plan in the resident section, and as a representative of the Fort Wayne Liberation Movement. It's a grassroots intersectional feminist organization in town. It's led by women, gender nonconforming, and trans individuals, and working for the most vulnerable in our city. We're here to oppose this health plan, right? The Senate and the House plan. If you are a woman, if you are a trans individual, if you're disabled, if you suffer from a mental health condition, if you're covered by Medicaid, this plan is an actual threat to your life. As a physician, I've seen the impact of expanding Medicaid in the clinic. I've been there when women have come into the clinic actually shaking with anxiety just to know the results of their pap smear, because they haven't had one in over a decade because they didn't have coverage. Something as simple as a pap smear, as cost-effective as a pap smear, not only does it save thousands of healthcare dollars by preventing the care associated with cervical cancer, but it saves lives. And so something that simple is what I've seen with Medicaid being expanded in our clinics here in Indiana. What we need is a plan that continues this Medicaid expansion, not that cuts it back for 23 million Americans. That is not going to save lives, and it's not going to save us any healthcare dollars either. This plan in the Senate guarantees that we'll see more women without coverage, more injury and deaths from untreated mental health conditions, more disabled persons unable to access the care necessary to function in a world that was not designed for their needs. It's bad for Hoosiers and will result in more deaths and discrimination, plain and simple. That's just the facts. So we urge Senator Young to oppose this plan and instead to take up a single-payer system like that proposed by Representative Conyers in the House Bill 676, and that likely to be proposed by Senator Sanders. We know that a single-payer bill gets rid of the overhead costs that's right now scattered across multiple plans and insurance providers, and brings that into a single plan, which is more simple, more cost-effective, and would cover all Americans, not just those privileged enough to have coverage right now. So with that in mind, we ask Senator Young to oppose this plan, to instead support a Medicaid for All plan, and something that will not leave so many Hoosiers behind, like this plan does currently.
Is a dear friend. I met her, she can explain. I call her a victim of American health care. She can say whatever she likes, but I made a documentary. We did a seminar at IPFW. So, Susie Renner.
As Terry stated, I am a victim of back then it was lack of health care available. My first husband killed himself as a result of a drunk driver hitting him, and it chopped his leg off. And years later, my firstborn son hung himself in my garage. He was in between jobs and was given a diagnosis of Wegener's granulomatosis, which is an autoimmune disorder. I met Terry because he had a meeting about healthcare horror stories, and in a way I could be labeled a victim, but I consider myself a survivor because I'm a fighter. And what I say to Senator Young is vote no, hell no, vote no on this. Too many people died before Obamacare came in, and now they're trying to take Obamacare away. I don't know all the statistics of who has Obamacare and who doesn't. I use Obamacare, and I'm on disability now, and I use Medicare, and I don't want my premiums to go up 5 times because I don't have the money. I have to survive. I've got one last payment on my van, and if, and God, I hope it doesn't go through, my husband and I might have to live in our van because we won't be able to afford to pay rent. We won't be able to afford to buy food when this type of insurance program, I wouldn't even call it an insurance program, it's like torture. Take away the ability to live and breathe. The people at the top have everything they need and more than what they want, and the folks at the bottom are doing all the work, paying all the taxes, and it's all going up to the people at the top. That's unfair, unequal, and it needs to stop. And I really don't know what else to say and how to end my words, but
Sorry for
America needs to wake up and take insurance companies out of the equation. They add no value.
You know, one CEO of one of these insurance companies just plainly says My job is not to help sick people. My job is to make money for my shareholders.
Right. Exactly.
What else can you say? There it is.
Plain
And
as day.
they give a lot of money to people like Senator Young and other politicians. And it's, anyway, I want to end the speaker portion with a poem and then open it up to anything you guys want to say. This is a poem called Our Turn. It's our turn, they sing, in gluttonous shrills of joy. Dismantle it all, making more for us, more for us, more for us, and line up the trucks to deliver banquets of sadness, illness, despair. After all, they mean nothing to us, those with their avenues to nowhere. Our blockades are concrete, and our gates are locked.
I want to thank everyone for coming. We really appreciate it. This was short notice. I'm sitting on the couch and see them taking all these disabled people away. Come off the couch. I am madder. Hell, because why didn't they send an aide out to talk to those people?
Exactly.
What the heck is wrong with them?
We don't exist in their eyes.
I don't understand that.
By the healthcare industry.
Secondly, Terry said, Edith, we need to have a press conference. Oh, no, we don't. No. Well, Terry started, so this was Friday night, and thank you all for coming in short notice. I want to thank the press for coming with short notice.
Yes,
This is because Terry and I get pissed off about this, right? And it's just criminal. It's just criminal.
It is criminal.
It is criminal.
Isn't this all about for 400 of the wealthiest families to give them a $7 million tax break? Every year, that's what health care is doing.
Well, you know, it is, I think Bernie Sanders and a lot of politicians talk about the inequality and the shift of resources to the wealthy, and certainly in my lifetime, and I'm 70, I certainly have seen that. You're not going to have a democracy unless working people think they have the hope to achieve something. You know, and I don't think there's a lot of people with hope. You're stuck in poverty. I am from poverty. I am from poverty, so I don't like all this trash talk about poor people. I went to school on the poverty program for the first 2 years, okay? Because at that time you didn't take loans from Goldman Sachs. You took them, national defense loans from the government. If you were a good student, you were able to get a national defense loan at a low rate. You could afford to move out into some dumpy apartment with your friends. Healthcare was not that expensive. You know, I want the Republicans to know it is Nixon in the 70s who expanded Medicaid.
Right.
It was Nixon. So, you know, it used to be that your senators and congressmen went to Washington to bring money back to your state. Senator Young, you're not supposed to take money away from us.
Right.
No, no, no. Everybody has something they want to say to the press. Anybody want to be? Oh, here comes Mary. Go ahead.
To be really
This is
quick,
Mary Gomez.
I'm hosting an Italian-American dual citizen right now at my house. He is so ashamed of American health care, and I've been to Italy enough to know that he's right. In Italy, the doctor's job and the healthcare worker's job is to take care of people and make them well. That's all they do. They have no insurance companies, and they devote all their revenue, or all the cost goes to care. He saw a commercial on TV the other day for an ambulance service. If you pay so much a year, they'll come and get you in a case of emergency. And he said, you mean in America you have to stop and think about it before you call an ambulance? He couldn't believe it. That's all I have to say. Time for America to wake up.
Said the morticians.
I'm Vicki Lamont. For years I took students abroad for an international experience, I had the memory of having to take students to the hospital in the UK. I got out my insurance card. They absolutely refused. They thought I was, I don't know what they thought. They treated 3 of us, gave us medication for nothing, and we were visitors. They said that's how they treat their visitors.
Exactly. And they did this back in the 70s.
Yeah.
In Thailand and Taiwan, they did that.
Well, what I'd like to do is I would like to call on Senator Young to take a page from Dick Lugar's book. We need to have someone use their compromising skills to negotiate with the other side. You don't have to be Republican or Democrat. You need to be for the people of the United States and stand up for us.
I forgot a few things I wanted to say when I was up here earlier. Senator Young, I would like to know how you would feel if you walked into your garage and found your adult son or daughter hanging on a rope. My son should not have died. He was in between jobs. He was a hard-working man. He didn't want to be a deadbeat father, and he chose to kill himself so his daughter could have Social Security benefits. What the hell? Senator Young, vote no. Too many people are dying.
Quick follow-up to what Susie said. Just a friend having chest pain, no money, no health insurance. He's done a lot for this community. He went to clinic Matthew 25, but couldn't find the problem. His friend said, "We got to take you to emergency room." He said no, because I don't have money to pay and I don't have any insurance to pay for it. He died the next day. I mean, seriously, what kind of system is this? Seriously. I mean, it's uncalled for and not necessary. I mean, there's no reason for it. I mean, it's not that America doesn't have money. It's will. And what they sign. Anybody else?
I think we all know that investing in healthcare pays off in the long term. It's big time. When you have a healthy populace, you have a productive populace, you have a happier populace, and you have less crime and less taxes. You bet. You know it. It's exactly right.
Molly brings up another point. Thousands of people lose their jobs.
Right.
Because they won't be able to be paid. Because people won't be able to afford to even get any health treatment. So people who work in the medical profession will lose their jobs. I just read 80,000 people in Florida. I'm sure it'd be the same in Indiana. So there's so many aspects, and they're all bad of this bill. All of them.
Right. Right.
Anybody else? You guys, great audience, wonderful speakers.
Everything you guys have said as it is.
Well, good, thank you.
Where are corporations spending billions of dollars on health care for their employees? When, if we had the government, if we had one single payer group plan that covered everybody, they could save billions of dollars.
Absolutely.
It's really a pain for employers to deal with it. I mean, there's nothing certain about it. Having all employers have to deal with all the paperwork involved with healthcare.
Yeah.
It's, you know, we spend more, I think, than any industrialized world in healthcare. We have the, you know, some of the worst outcomes. We don't, you know, lifespans in Europe are I think, greater than the United States. If I understand.
So we suggested that Senator Young watch the movie Fix It. I sent him a link. I don't know if he's watched it or not, but that's all included, and very much from a business standpoint, which is what seems to talk to politicians. Let's talk about that.
It
Yeah.
used to go this way with us,
Yeah.
but
Yeah.
now it's only the pharmacy companies.
Yes, that's right. Good point.
That's the throttle that insurance companies have on everybody. Even the corporations like GM. I mean, look how much money they spend.
Self-preservation. Companies, not for individuals.
You made a good point.
And that's why we don't have single payer. That's exactly why there's so many rich folks
They're
that got
the richest
hand in
corporations
that
in the
bucket,
world.
they're not taking it out. What I've always been wondering here is, what the hell did these rich people, they want to live in a country where all the millions of people are going to be dying in the streets and living homeless and
Yeah, that's exactly what it is.
do they really want to live in a country that looks like that? Look at
You can't see out their car windows.
They can't see from their island view.
Look at all those people swimming towards us. Look the yacht.
Yeah, something that you were saying in the businesses is right now you're tied, your employer. Like there's a lot of people that would go, be more entrepreneurs, yeah, and go and start small businesses and expand it, but they're afraid of losing their insurance. So, what kind of pro-business? That's not pro-business. I mean, I don't know.
No, the businesses could give their employees more of a paycheck so that they stay with them longer. It's a win-win.
Yeah, but it's so short-sighted.
Yeah.
Why should employees be locked to an employer that carries their insurance either?
Yeah.
Right. I don't know how many teachers I know that said, I would retire if it weren't for the insurance.
Well, that happens in every industry.
Yeah, true, for sure.
So I think we have to go a different route on getting this passed. We have to go to the corporations and then and then tell them how much money they're going to save, because that seems the only language they know.
If you look around, there's not very many young people here, just a few.
Yeah.
Well, it is.
They're working.
They have to
work.
That's the point. Right. But if you talk to young people, sometimes they have this attitude that I don't want to pay for the old. Well, not only will they not be getting old, but also they will be getting old, but any accident that happens to them can bring them to the brink of bankruptcy.
Forever.
That's typical of young people. They don't think about that.
They're
They really don't.
invincible when they're 20 and 30.
But don't feel like it.
I
No, in defense of young people, they're a lot of them burdened with college loans and a lot of the stuff that Bernie talked about.
Which is the most expensive in the world again.
Represent them also, because I know they're working.
And this is our lunch hour. We're working too. People like us are fine. We got Medicare. We're fine. We're out here because we care about what happens to our children and our grandchildren.
But they're going to chop that too. They're going to chop it off.
Well, yes, true.
Yeah, everybody, even employer plans are going to be affected by this Medicare pay cut.
And I agree. How can we approach businesses to get involved in this? I think that's a really a good point.
We need to get a lot of business leaders to see fix it.
Yeah.
That's one thing.
To look at, like LinkedIn, take a look at your data, their data
Spreadsheet.
Yeah, let's take a look and see how much you're spending on healthcare, what you would gain by going to a single payer, and get those folks on board. I think that's, a rally of 50 is probably not going to make a lot of difference.
Yes, it does.
But it helps. It helps. But let's make it bigger.
The business is connected with each other, and so sometimes they'll be looking out for their friends in the insurance industry or the healthcare industry, and you need to break out and say what is best for your business, for your bottom line, for for the communities that you're a part of.
Yeah.
And you got to break it.
Vote Trump.
Karma's a bitch, isn't it?
Watch your step. You might fall into some crap.
Her insurance is about to be a little iffy.
Bye-bye. Thank you so much, John.
Anybody else want to say anything?
No, I'm glad we can go down.
I am too, but it was just enough of a nudge.
God was watching.
Yeah, he was. It was great.
Anyway, if nobody else,
We're going to do something for Medicare's 52nd birthday around July 24th. I think Indivisible is for our revolution. Somebody is going to do the Medicare for All March, and we thought, I don't know when it is, it's the 24th, but I don't know what time, but we, Hoosiers for Common Sense Health Plan, thought we would tag on with either showing Sick Around the World at the library or the C2G, but just stay on Facebook if you can. It's July 25th is Medicare's 52nd anniversary, so I don't know if we don't, without Dave Lambert, we don't have all the audio and stuff when we used to do it at the courthouse green with microphones and music. You got that? No, they dropped, they got off of the exchange.
It's not going to be available for the exchange next year for not enough.
Well, did you get it on? Did you get it on the exchange? I got it on that's you right now. Yeah, you'll have insurance. A few years, we don't know. How did he get on this?
Thank you.
Bye-bye.
I'd like to add something too. The gentleman that said to vote for Trump. I saw during the election, Trump promised his supporters that he would have a better health care plan than Obama had. Everyone would be included. So Trump supporters were lied to during the election. I did not vote for Trump, but I did see that they were lied to about what sort of plan he would put in place. He said it would be better than Obamacare, and one would go out and the next one would go in immediately. And that information, that interview and other interviews like that are available on YouTube. So Trump supporters were lied to. And there's no reason to back a bad plan. We're all in this together. We don't need to play party lines here. Everyone is taking care of elderly parents and grandparents and knows that heartache, or have children or young adults or middle-aged people experiencing health problems. We're all in this together. It should not be party lines. And so I hope everyone gets on the phone today and blows up the phone lines. They do count phone calls. It does count. Be very respectful, of course, to the person on the other end of the phone, and just make your concerns known, because they do count phone calls. It does matter. So thank you so much, and thank you to Terry Doran for putting this together for us. Thank you for Public Access for promoting this too. Thank you.
Get everybody lined up and just get it
I think we had a good amount of time.
Yeah.
You got it.
This is the important one. I mean, everyone else is important. This one is the actual part.
I have the name of the speaker. I have the name of the
I think people got so sad. I think that a lot of people got